morning. Welcome to this second plenary session. The title is Health Technologies and Managerial Processes, Strategy and Tools for Evidence-Based Decision Making. Actually, we would like to talk a lot about health technology assessment. Health technology assessment has been evoked yesterday by the Minister Schillaci. We have talked about HTA, also during the plenary session dealing with Sustainable Development Goals. And today we dedicate this session of EHMA to this topic. What we would like to do is to address different aspects. And we think this topic is quite relevant. As you know, WHO is considering HTA as a crucial approach, trying to ensure the universalism of public health systems, and also as an approach to foster patient access to valuable health technologies in our healthcare systems. This approach is multidisciplinary and multi-stakeholder by nature. And also we try to represent these characteristics in this panel. And we would like to look at different perspectives, of course, starting actually from the patient perspective in the assessment of health technologies. But we would like also to look at the trends that we have in front in, this, in the use of this specific approach. Firstly, starting from what is happening at European level, we have a new HTA legislation that is trying to harmonize and the different approaches followed by different agencies in member states. The goal is to accelerate the evaluations and also the introduction of valuable technologies in our systems, in our hospitals, but also we are facing new challenges, also from a methodological point of view. We have new technologies, drugs combined with digital solutions, we have artificial intelligence, and actually we need to understand how the methodology is sufficiently robust to answer to these challenges. But actually, in this plenary, we would like also to, let's say, shift also the attention not only, actually from the macro level, because HTA has been used to support decision-making at policy level, at macro level, but actually has been experimented as a tool for management, so to support the management of health technologies in healthcare organizations. And we would like to also look at this, the appropriateness of the use of this approach at this level. So all these points will be touched by our panelists, but first of all, let me introduce to you Rabia Sucu Kaveci. She's Vice President of Health Technology Assessment International. In a few weeks, she will be the President of HTI in the annual meeting in Adelaide, in Australia. She's a medical doctor, and she has been active in HTA for many, many years, dealing with both, all the levels of the application of HTA, national, regional, and local level at hospital level. So thanks for being here with us. Rabia is going to introduce the topic with a keynote speech. Rabia, the floor is yours. Thank you.
Thank you, Mirko. Dear colleagues, good morning. It's a very privilege to be speaking to you, such a distinguished audience, and it's always nice to be in Rome. As usual, I'm happy about that. Today, I will try to discuss with you where does HTA stand when we look into our decisions from science to management. So I have observed, as Mirko said, in the last 2 days since yesterday, in many sessions HTA is cited, but we do understand also there's a diverse group here. Not everybody may be comfortable about it, so we will just set the ground for basics of HTA, like what it is by definition, and why we do need it, how we do it, and for which decisions we use it, and then maybe go a little bit deeper into what technologies are emerging in the world and how we evolve our methods. So University of Massachusetts Dartmouth has this 7 steps to effective decision making. This is not about healthcare, this is just in general for any decision making. So this approach they talk about here increases the chances that you will choose the most satisfying alternative possible. And these 7 steps include identification of the decision, so you know what decision are you looking for, then gathering the information, identifying the alternatives, weighing the evidence, choosing among the alternatives, taking the action, and reviewing your decision. So this is the way for effective decision making. So basically it's about the alternatives and weighing the evidence around the alternatives. So we say this is in general for all decisions, and for healthcare decisions, what HTA does is actually HTA supports this type of effective decision making. It's the major tool we use for this purpose. By definition, HTA is a multidisciplinary process that uses explicit methods to determine the value of a health technology at different points in its life cycle. And the purpose is to inform decision making in order to promote an equitable, efficient, and high-quality health system. So this is the main definition. There are a few keywords here that we look into the value of the health technology in any point in its life cycle, and basically the purpose is to inform decision making. So HTA experts don't make the decision, but their main objective is to inform evidence-based decisions. And definitely it's a formal, systematic, and transparent process using the evidence. The value judgment here may depend on the context, depending on the perspective you take or the stakeholders you involve. So it's very much context dependent at the end because the decisions are context dependent. The health technology we define here, we need to define it because most of the time when I ask audience, give me an example of health technology, they usually give very sophisticated, like big ticket technologies, but actually it's, the definition covers any medicine, any diagnostic test, medical device, vaccine, screening program, surgical intervention. So it's a very broad definition. Any intervention you use for promoting health, for diagnosis, for treatment or rehabilitation. So it's a very broad definition we have here. And why we go through all this trouble, like looking into different aspects and looking into the value? First of all, for the decision-making process, HTA helps us to have the process more rational, more evidence-based, justifiable, accountable, acceptable, more transparent, and definitely at the end, more value-based. And we have to engage with lots of stakeholders, otherwise we can't be successful in our aims. And the stakeholders here we talk about can be divided into 2, like HTA doers and HTA users. The people who do HTA, the organizations who do HTA, basically it's the expertise level that you do technically do the expertise. These are either located within government structures like Ministry of Health, NHS, and a relevant agency with this purpose, or it could be located in hospitals if we are talking about hospital-based HTA, or it could be from time to time manufacturers may be requested to submit, or academics or private institutions or NGOs may be engaged with the HTA functions to do the work. And anybody, any organization who is using HTA for decision-making or who is impacted by the decisions or HTA conclusions may be considered as users. This could be any government body, Ministry of Health, NHS, procurement agencies, again, hospitals, insurers, or the individuals like patients, clinicians, or their associations, as well as the researchers itself. So it's a very broad stakeholder group we are talking about here. And with these stakeholders and considering the context in mind, the domains actually are standard. So how we do it, how we do HTA, it has certain domains, certain aspects that we take into consideration about introduction or use or disinvestment of a technology. So what are these components, these domains? First of all, we look into the technology specifications and the indication it's used, but then we identify the alternatives and compare the effectiveness and safety. So that's the first component. And the second, we look into the economic aspect, like cost effectiveness, cost utility analysis, and so on, and budget impact, of course. So we look into the economic aspects of using the technology. And later, we have many other aspects we take into consideration, because technology's use is not only about clinics and economics, but there's legal considerations, ethical, social, organizational aspects that we need to take into consideration. And when we make this assessment, we have the conclusions, we have the recommendations for the decision makers. And the decisions these decisions makers are making are around either drawing health benefits packages, or could be about procurement plans, could be pricing of the technologies, could be around reimbursement programs, or any public health programs such as screening or vaccination programs in the country. And overall, by HTA, we also aim to improve quality and patient safety. And definitely HTA recommendations can be used to inform clinical practice guidelines. So that's how we use HTA for this type of decisions. And it could go in all levels. It could go in macro decision-making level, meso or micro levels, which means at the national level, you can use HTA to inform an overall national screening program, for example. And at the meso level in a hospital, you may simply use HTA to make a decision around investment in a certain technology. Or at the micro level, when it comes to patient-clinician interaction, you may simply use HTA findings to inform that. And by definition, we said it is identifying value of the technology in any point in its life cycle. Traditionally, in the past, we were more looking into the technologies that are established, already market authorized, and it's there, and you make a decision whether to reimburse it or not. But this is becoming an older approach, because over time we realized that in order to provide maximum benefit and maximum value for technologies, it is more important to engage earlier in time when even the ideas are developed, innovative ideas are developed, R&D phases, the clinical trials are designed, and it comes to the market authorization process. So that's why right now we talk about using HTA or HTA principles way earlier in time with very close interaction between all stakeholders, which includes industry like manufacturers and HTA experts interaction, as well as interaction with regulatory bodies and patients and clinicians engagement at all times. And here we keep talking about value, and we see that it changed using HTA in the life cycle. I see it, well, I'm a little bit interested in sociology, so I read a lot in that aspect as well. And in sociology, in recent 10 years, we are talking more about value-focused thinking. So this is a little bit different from the first slide I've shown about alternative-focused thinking. So in the past, what we were doing, we focus on the alternatives and we try to select the best. But when we focus on the value, which we're doing more and more over time, when we focus on the value, actually you change all your processes, methods, and your vision, and you actually can create alternatives yourself. So that's why shifting towards value-focused thinking has been providing more interaction between stakeholders, as well as ending up with better decisions. And Albert Einstein says the measure of intelligence is the ability to change. So Einstein himself was an intelligent guy for sure, but healthcare system and healthcare professions are intelligent as well, and definitely we have the ability to change. And HTA has been also changing and still continues to evolve. And in what ways HTA has been changing? As I gave a few examples when I was speaking, HTA methods and processes over time has evolved. It's improving. Like how we look into evidence. We are using like real-world evidence more than we were using before, and definitely methods around it also evolves. In the processes, we engage with different stakeholders way earlier, and the technologies of attention changes as well. Because the technologies we are talking today and we are paying attention, they were not existing many years ago, so the methods never included those aspects. But right now we are paying more attention to new technologies and value in points of life cycle, how we see it differed. And when we changed all of this, actually decisions to be informed also changed. Before it was mostly about reimbursement decisions and so on, but right now we do also engage with manufacturers earlier in time, which can also affect decisions around investments in R&D, for example, which was not present before. So it's an evolving area as well. And for the stakeholders we engage, we are trying to engage more and more with patients, clinicians, manufacturers, and we are developing tools and the facilitators, let's say, how to handle this. And last but not least, attention to other aspects. When we make the definition, we say usually, okay, we look into clinical and economic aspects, and sometimes we talk about it like for hours, and then we say with just one sentence, oh, we also look into other aspects, such as social, legal, and organizational, and so on. But recently, we did realize that these aspects are not should not be underestimated, and there needs to be special focus how to look into ethical aspects, for example. That's why in HTAI we have a special group working on it and looking more into legal and social aspects. But organizational aspects, it's very important, especially for medical devices, equipments, and newer technologies, digital technologies we are talking about. But also, since yesterday, we have been discussing with colleagues that how much we have ignored, including environmental impact as an aspect here. So basically, such impact on the environment, it was embedded in safety component and organizational impact, but not as a separate one. So that's why we do suggest it should go that way. And all these changes are happening within a context and within ecosystem. So we can't think all of these independent from the ecosystem we are making decisions in. So when we look at the top 10 technology trends, which is changing every approach we are taking, we do see a lot in these new trends. Artificial intelligence on top, VR, robotics, digital therapeutics, wearables, and so on. These are very new to us, and we have not yet developed all the methodologies like standardized and with consensus. So this is a very high topic. I want to give as a last slide just one example around list of challenges that we face with artificial intelligence when we are evaluating the technologies. One component is technological, where, for example, data you use may differ in real life and in laboratory conditions, and clinically how you are going to engage these into your routine clinical strategies, and by human and cognitive sides, like for patients, clinicians, how these affect patient clinician interaction or clinician-clinician interaction. And definitely, professionally or organizationally, you need to consider these, how this will affect your organizational design and how you are going to finance these. And definitely last, but maybe one of the most important, if there's any patient harmed in this process, who is going to be accountable? So there needs to be lots of discussions around legal too. And so, just a summary, there are lots of challenges, and all these challenges have to be addressed, how we evolve HTA in the future, but these are definitely the top on our agenda that we are focusing on. And I want to, again, finish with a quote. With or without technology, change is certain. So Einstein said that, and we agree. But for the technological change, however, what is not certain is driving the change or being driven by it. So that's why right now it's very good that we are discussing it more and more, and definitely timely, even sometimes we say late. As Dimitra was saying yesterday, it's from Santa we can ask extra time from back, that we should go back and change things. But definitely, when we discuss it more and create new approach, we can be the humanity side that's not being driven simply by it, but we can drive the change and we can make value-providing new technologies available for our populations. Thank you on behalf of HTAI as well, and very happy to engage more with EHMA members from now on. Thank you.
Thank you very much to Rabia Kaveci. Really, in few minutes, you were able to give us the broader view of what is HTA and where we are going, actually, which are the trends and the scenario in this field. And in the different expression that you have touched, I think probably value is the most important one, because actually, probably one of the major challenges for who is doing HTA is trying to use evidence to support decision-making at policy level, at the managerial level, but really we need to understand where is the value and which is the concept of value that we would like to, consider when we take this decision. And of course, it is depending by the perspectives, the stakeholder. And as I said, we have tried to combine a panel that is able or should be able to represent all these perspectives. And I would like just to introduce our panelists. On the first seat, Valentina Stramiello. Valentina is the Director of Programs of the European Patient Forum. Dimitra Pantelli, that you know, Program Manager of the European Observatory on Health Systems and Policies. Marco Marchetti. Marco Marchetti is the Director of the HTA unit of Agenas and also is sitting in the coordinating group of the European HTA. Thanks, Marco, for being here. We have in connection Laura San Pietro Colom, that wasn't able to catch her flight this morning, but we are happy to have you at least in connection. Thanks, Laura. Laura has been president of HTI and is deputy director of innovation and head of innovation assessment unit at the hospital clinic in Barcelona, in Spain, in Catalonia, sorry. And Iga Lipska, she's the chairwoman of the Board of Health Policy Institute in Poland. So I would like to start immediately with Valentina, because probably the most important perspective is the one of the patient, of the final user of health technologies. And we know that the engagement of patient association, patient group in HTA has been increasing over time. But we cannot consider a mission that is already achieved, or there is something to do more.
Thank you for this question. It's still challenging. The concept of patient involvement in HTA is there, and as Rabia mentioned, patients are among the key stakeholders to be involved in HTA. And we see also how relevant their involvement is, because they can identify important outcomes to be considered during the assessments. But it's still not a given, because it implies HTA bodies to be aware who should be involved, when, and how. And this requires somehow also a capacity building for HTA bodies. It's not given that assessors know all of this. So as a patient organization, so we are promoting, advocating, for patient involvement more and more. But of course, we are aware, especially when it comes to new technologies, artificial intelligence, digital health technologies, that it's still quite challenging, really also identifying when this involvement should take place and to assess what. So that's still a work in progress, I would say. But I would say the very first point would be really make sure that patients are involved since the early stages, even before you want to start the assessment. I talk to patients to understand what their needs are. This is the very first aspect to be identified. And once the needs are identified, bring them on board in the co-design of the methods, even, I would say. Of course, you cannot bring on board whatever patient. For that, you need to bring on board patients with expertise, who do understand HTA and who do understand the specific disease area. So it implies a lot of work for us as well. So I would say it's a kind of a boomerang for patient organizations, because we keep advocating for patient involvement, but this all comes back to us as a big burden in terms of workload.
Definitely. But we hope that this burden will increase, because that means that the voice of patients will be much, higher and more important in the decision making of the politics and the policy level, but also more important for those that are responsible for the assessment. And here I would like to involve Marco Marchetti, because Marco now is really sitting where the action is. Now, at least in Europe, in 2022, finally we were able to launch, after 25 years of, let's say, training, thanks to the European Network of Health Technology Assessment, a legislation, a European legislation for HTA. The aim is supposed to be to, harmonize at least some of the phases of the HTA process. And the question to Marco is, which is the state of the art? We know that on January 1st, 2025, the system will be in force, and the activity should start. Marco.
Thanks for the invitation, firstly, and thanks also for the question. Actually, probably the HTA regulation implementation is the key point in the European scenario, and probably not only in the European scenario. We have two different points. The first point is that we have to look to the HTA regulation in a more wider framework, a more wider strategy of the European strategy on health, that see the HTA regulation, the new MDR and IVDR regulation that give more importance to the clinical effectiveness, so also in order to obtain CE mark. Then we have also to look to the HTA regulation, to the strategy, considering the two new proposals for new regulation, the European Health Data Space and the new pharmaceutical legislation. And the objective is to increase and to make faster the accessibility to the new technology to all the European citizens. Coming back to the HTA regulation, actually we have completely finished the governance structure of the regulation, because it's the first example of a European regulation that is an example of co-legislation, in the sense that is the first regulation that is not managed by the European Commission. European Commission is giving the technical, administrative support to the implementation of the implementation, and then in the entering into force of the regulation. But the main body that the responsible for the regulation is member state. This is the reason, because the regulation foresees the establishment of an HTA coordination group, and in the context of the HTA coordination group, all different 27 member states are sitting. So now, in the last April, now we have the coordination group that has been established in the last June. In the last November, we have been the approval of the rules of procedure of the coordination group and the election of the chair and the co-chairs of the coordination group. One first point that I think is quite interesting is that in the meeting on November, the coordination group decided that for at least the next 2 years, the coordination group is going into what is called a joint configuration, because originally the regulation foresees two different configurations, one for pharma and one for medical devices. But there was the consciousness by different member states that at least in this first phase of the implementation, we need to go together with the two configurations. So, considering, recognizing differences among pharma and medical devices, but we are now working in one joint configuration. In the last April, we finished the establishment of different subgroups that are foreseen by the regulation, so the joint clinical assessment, the joint scientific consultation, the methodological groups, and then the emerging technology groups. So the regulation foresees for each different subgroup a specific task. What is happening now is that in the next week we are going to present to the coordination group the work plan activities for 2003 and 2004. And from January 2005, the regulation is going to enter into force. What does it mean? That joint clinical assessment, joint scientific consultation will start in January 2005 for advanced medical therapies and for oncologic drugs. In 2007 from orphan drugs, and in 2030, January 2030, complete full application for pharmaceutical. For medical devices, what happened? We are going to, we have a point in the agenda of the next coordination group, because the regulation is not foresee a specific time. It means that it's expected that from January 2005 something will start, and for sure joint scientific consultation is quite is going to start, I presume, and later on also joint clinical assessment. But we are going to decide this in the next coordination group.
Marco, I think it can be relevant. This regulation is not mandatory. I mean, the use of joint clinical assessment for member states will not be mandatory, but strongly recommended. How do you perceive this as an opportunity, as a challenge? What the member states are doing? You know, how Italy is doing, how Germany is doing. What is going to happen? Because this is the real question now.
The regulation had 4 years of negotiation among different member states, and actually it's true that it's not mandatory, but is strongly recommended to keep in consideration, if not, to explain the reason because. So it means that one of the main...
Probably it's the first time that the European member states were so pushing in trying to have a direct implementation of a policy from the European level to the national level.
And one of the key points is the establishment of the IT platform that is the point in which all interaction among manufacturers, stakeholder, member state, and what is the reason of the importance that through this IT platform also member states need to go into their explanation why they are not giving to receive the recommendation, if they decide to start with a parallel process of evaluation.
I'll be back to you, but I would like to involve Dimitra Pantelli because one of the major trends in technology, health technology development, of course, is related with digital technologies, digital therapeutics, and so on. In your opinion, which is and also on the base of the evidence that we have, how much the approach of HTA is ready from also a methodological point of view to assess, this new wave, let's say, but also the integration of digital therapeutics with drugs, with medical devices, because we have also learned that there is, a trend in the integration of different technological platforms. Dimitra.
Yes. Thank you very much for the opportunity, and thank you for having me. It's a really difficult question. I think if you looked at Rabia's slide earlier about the trends in healthcare technologies, most of the points among the 10 had somehow some relation to digital health. So I don't think we can talk about methods in general, because it's quite different if you're trying to evaluate a telemedicine program, for trying to evaluate an AI algorithm, for trying to identify a patient-facing digital therapeutic or diagnostic tool. I think saying we are well equipped is perhaps not a bad start. We are well equipped when it comes to our overall methodologies and the processes and all the work of collaborative efforts over the past few years to know the frameworks within which we are actually able to work. We are not there 100% also because technology keeps evolving, and this is a good thing. It means also that our methods and our processes and the way also that we integrate health technology assessment results into decision making has to evolve. And I think the one example that I can bring, which is based on our experience with the observatory, but also based on the experience of one of our research hubs in Berlin, is the 2019 law in Germany that basically introduced the reimbursement from public funding for digital health apps. This was seen as a pioneering step because it gave a platform for manufacturers to apply, to go through the regulator for medical devices and pharmaceuticals in Germany and receive, let's say, an entry to a registry via which they were entitled to statutory funding. And we had quite a lot of discussion back then. We were, with our hub in Berlin, working on advising the ministry on how to shape the policy about, for instance, the level of evidence that you need for this type of medical app that is a low-risk device, can be considered a low-risk device, and is expected to be low cost. So the discussion was, do we need really rigorous evidence for this type of technologies if we know that they are not going to be of a huge budgetary impact and we're trying for a relatively low impact effect? And we had differing views from people who have been long in evidence-based decision-making and for people who were advocating more for faster access, therefore lower evidence. In the end, the process fell somewhere in the middle. And what we see from the medical apps, from the health apps that have now been on the registry in Germany, is that the majority have a randomized control trial to show, at least for those who are on the registry. But the trials are of relatively high risk of bias. So we do have a way to go to figure out what trial designs we need, how we can enable manufacturers of such technologies to actually carry them out without going under financially, and whether we're happy with it. Because the final link, and I'll wrap up here and then maybe we come back later, is that from a public payer's perspective, it's important to have this type of process for two main reasons: accountability, to show how you invest your limited funds, and also to make sure on a value-based pricing level, purchasing level, that you actually invest in technologies that make sense. But if you lower your evidentiary standards, it's not just that you're exposing patients to risk, it's also that you then pass the ball on the decision-making process to someone else. So what we see in Germany is that the prescription rates of these apps are not as high as we would have expected them to be, because the physicians who are responsible for prescribing them are not confident enough because the evidence is not strong enough. So we need to figure out, when we think about managerial processes, that there are different levels that have an interplay when it comes to how health technology assessment works and what it actually means in the end. And we can return to that in a minute.
Yeah, thank you. No, thank you very much for, because we have touched the issue of the apps, the health apps. And I know that European Patient Forum is engaged in a specific project because, of course, it's not so easy to understand the value behind an app, an health app. Also because the value is related to the ability of the patient of using, you know, the level of digital culture, let's say, and digital literacy of the patient. Give us an idea what you're doing to face this issue.
Yeah, thank you for the opportunity to share. So the initiative is called Label to Enable. It's an Horizon Europe project that started in 2022. And basically, it is led by Leiden University. The intention is to support the end users, so patients, healthcare professionals, but also authorities and HTA bodies, in really identifying the most appropriate digital health apps. Because we know there's a wealth of apps in the market, and it's even for the healthcare professionals, it's very difficult to identify what they should prescribe to the patients. So Label to Enable is basically developing a quality label, which is inspired by the Nutri-Score or the Energy Score, just to give you an idea. And it's actually a certification that is built on a number of criteria, including indeed the safety of the tool, but also making sure that the data that patients are sharing are kept safe and not easily shared with third parties. So there are a number of criteria, and this quality label is going to support healthcare professionals, patients, and authorities to really identify what apps should be reimbursed. The project is working closely with HTA bodies, with assessors, to really make sure that this tool, as soon as it is available, can really be a supporting instrument. Because it's actually very, very difficult for, we have talked to healthcare professionals who are active in digital health, and they told us, we are already busy, coping with a stressful work. It's, we know, it has been discussed these days also, the pressure put on the healthcare workforce. Even having to prescribe digital health apps adds another level of complexity to their work. So we have to find solutions that make their work easier.
Thank you very much. I think that we are going to be back to this issue. But now I would like to, let's say, move down in the system, because Rabia was mentioning before that the health technologies are proving their value in their context. And many of the health technologies are introduced in hospital care, of course. Yesterday we had this panel with the colleagues of Philips. They were discussing about the carbon footprint related to the introduction of such big technologies and how to face the problem. And little by little also health technology assessment with the different disciplines and methodologies to be applied to assess health technologies has understood that actually the value should be assessed at hospital level, at organizational level, also because, again, the innovation is entering through the doors of the hospital. And Laura San Pietro Colom was coordinating a very interesting project. Now, Laura, few years ago, probably 10 years ago, but I think we have learned something about the potential application of HTA as a tool for management of hospital and other healthcare organizations, and to make, let's say, the HTA real, able to influence the pattern of introduction of health technologies for patient care. Laura.
Yes, thank you very much, Americo, and good morning, everybody. First of all, I apologize for not being here in presence because last minute unexpected reason has not been allowed me to come to fly today. Anyway, yes, I've been working at hospital level during the last, maybe I say 15 years, introducing HTA at hospital in a big technological hospital in Barcelona. And I have to say that HTA has helped a lot in making decisions about the investment in technologies, making the trade-offs for the heads of departments, of the medical director, of the general director of the hospital, trade-offs on what should I invest for this technology or this other, no? When different clinicians come asking for very expensive or sophisticated technologies, and we have this amount of budget, no? And through using our own data too, we can contextualize how this technology is going to impact in my hospital for the type of patients I have, and also for the type of organization I'm having, because probably most of you are working in different hospitals in different cities, and in a same city, different hospitals may have different organization of the same pattern of care, and a technology may impact differently in one hospital and the other. So during a lot of years, I've been helping doctors side by side to assess the value of technologies that they wanted to enter. But also, I have to say, and Dr. Rabia Sucu has mentioned at the beginning of her speech, that HTA also can be used for different, I may say, different issues along the life cycle of the technology. And as you know, especially in high-tech or teaching hospitals, there are a lot of what I like to say brains, a lot of gray matter, and a lot of clinicians are developing new technologies that they want to transfer to the market. So HTA units at the hospital like mine, the one I'm just chairing, we are side by side with the clinician trying to just direct the way they are proving the value of the development they are doing. For example, we have been helping some cardiologists that were developing softwares for magnetic resonance to just identify if there were, after an myocardial infarction, if there were some still conductions there. We were helping them to assess how this technology brings value to their day-to-day care, and not just in the clinical side, also in the economical side, so they can prove the value, and then they have more chances to look for investment from capital ventures or business angels or so on. So there are like two types of how hospital-based HTA can be used: for technologies that want to enter into the hospital, helping investment decision, but also technologies that are developing in the hospital and want to go out. But additionally, I would like to mention, Americo, and if you allow me to extend a little more, is that as
Sure.
Dr. Rabia Sucu mentioned, HTA is adjusting to time. So this is not a static discipline. It's a discipline that is evolving with time. So now we are using a lot of real-world evidence produced in our hospital to inform these assessments, but also more and more we are entering in innovative public procurement. So we are helping procurers at hospital to buy very innovative technologies, and not just only by giving information of potentialities, but also to helping the doctors to develop what I would say evaluative evidence. So evidence that will have to demonstrate the value of this innovation through the procurement process. And added to this procurement process, we are also showing and applying methods, HTA methods, to look at the scalability of this innovation for other hospitals in the regions. So this could be the third, if I may say, the third arm of hospital-based HTA. So I've been talking about introducing technologies investment, developing technologies and transferring technologies, then innovative public procurement for these technologies that is hard to get into the market, but we know that probably they have a big value for patients. But also there is another one that is trying to cooperate with some companies that more and more are looking for showing the value of their technologies in a real setting using real-world evidence. So we are making strategic alliances with some companies that have products that sometimes they are still not in the market, they are just entering, not as much, but other times are just starting to enter. And we help them to produce the evidence that later HTA agencies at national level would need to inform and to evaluate the value of this technology. So I think that hospital-based HTA has a lot of potentialities for the hospitals, and actually it's being used quite a lot.
Laura, just a quick feedback regarding the how do you think is at the end of the day is important the collaboration between the hospital, and how it is possible, and if it is possible, the collaboration between the hospital level, regional, also Spain as a regionalized system in the healthcare setting, and the national HTA bodies, and now with the European level. It is possible to an integration, it is useful.
Yes, well, for sure, for sure. And one thing that in Spain is happening, as you know, Americo, is that we have 7 regional agencies in Spain that they are working in like a network. So they work as a network, so they don't duplicate the assessment in the regions. They use the worldwide recognized scientific methodology to assess the technology. So they work as a network. And recently they asked also hospitals to show, and universities to show what they are doing and how we can put together efforts, because as you and mostly all the people in the audiences know, there are a lot of technologies to evaluate, and the skills and the knowledge on how to do it is not as, there are not as much, no? So we need to just keep together and just to coordinate efforts to assess this type of technologies. And also, I think that more and more, because of the hospitals, we have real-world data, we can highly contribute with regional and national HTA agencies to complement maybe their assessments or to help them to assess innovative technologies.
Thank you. Thank you very much, Laura. Actually, I would like to go to Ipska, because sometimes, and it's also the experience of Italy, for example. In Italy, we were lacking of a national HTA body. Actually, now we have distributed the responsibilities between the National Drug Agency, Agenas, and actually we arrived very late in comparison with many other European countries, at least to have a mature HTA model. We have started from hospitals in doing HTA, and Marco, we remember well because we have launched the HTA unit of Policlinico Gemelli back in 2000, so we were working together as a pioneers, actually, because no HTA body in Italy was present at the national level. We know that the Eastern European countries are following more or less the same path, and also Poland. Is it true, or what you're doing? How is emerging HTA in your hospitals?
Thank you for inviting me, and thank you for the opportunity to speak on behalf of Poland and Central Eastern countries, European countries. So I think there are a lot of aspects, so you need to consider different perspectives. So actually in Poland, that's interesting because we started really from national level. So the focus primarily was pharmaceuticals and even much narrower scope. So we focused on innovative pharmaceuticals only. So we started back in 2005. I was employed in HTA National Agency in 2006. And based on international experience, we implemented HTA methodology, guidelines, etc. at national level. And then right now it's, let's say, mature. HTA National Agency still exists. It has evolved a lot. It is a really strong organization right now in the system. However, it's not so easy and straightforward, as really hospitals are real entry points for innovations, and I want to emphasize this. And as we talk about digital health technologies, etc., the progress is so fast that national HTA agencies are a little bit behind. So that's, and it's quite, I'm not complaining, that's normal thing. So at national level, it takes more time to react, to implement, to assess health technologies. So what we, and actually inspired by Laura's project, by Adopta, we actually prepared a kind of research scientific grant back 5 years ago to implement hospital-based HTA in Poland. So that was a kind of structural approach to come and to collaborate with hospitals. And actually, the grant I had my privilege and honor to be the project leader for this project. So we started based on HTA methods. We started to collaborate with hospitals. We learned a lot from hospitals, and hospitals learned a lot from us. And I think I really believe it's all about value of health technologies, but it's also about the evidence for decision-making processes. And you can consider different levels of decision-making processes, but still, and I really believe in this, it should be evidence-based decisions. And when I made a lot of interviews for this research with hospital managers, and when they spoke with us, they really emphasized, they make so many different decisions. The progress with innovative digital technologies and other medical devices, etc., is so fast that they have to make really a lot of decisions. A lot of people, industry, companies, medical devices companies, IT companies, etc., scientists come to hospital managers to ask them to beg about implementing particular health technologies. And they have to make decisions, and this evidence have to be these decisions has to be evidence-based because they want to feel secure, they want to be safe, they don't want to be accused of corruption, whatever. So it comes about public procurement, it comes about different aspects for decision-making processes. So at least it's from my experience, we piloted hospital-based HTA program in 7 hospitals in Poland. It's already 1 year after we finalized this project. And as Laura is probably aware of this, as there is no more finances available for hospital-based HTA, it's a kind of slowing down a little bit, but we still hope that hospitals are confident enough to implement this because it's a safe and good tool for them. So we are going to work around this with hospitals. But I have to come back to what Dimi said, I think yesterday, not even today, that there are a lot of different aspects you need to consider, and environmental aspects are one of those. And hospitals, it's not considered at all at national level because it's quite difficult to adopt HTA methodology at national level for reimbursement of new pharmaceuticals. Why to consider environmental issue? We should, probably, but it's quite difficult how to do this. While at hospital level, I mean, hospital managers are really, this session showed this, this conference showed this. They are more aware of, they need to adapt to green hospitals, trends, they need to be updated, and they need to consider this. So I think it will be, environmental aspect is one of those aspects which will be probably easier to implement at hospital level. That's what I'm trying to say.
Thank you. No, it makes sense, definitely, because some of the issues of the real impacts of the technology, the introduction of a new technology can be seen, where the action is, so very close to the patient care.
It's real life. So I'm a medical doctor by background, and I have to say I was not aware of environmental issue 2 years ago. 1 year ago, I learned a lot about at HTI conference, actually in Utrecht in the Netherlands. It was the first session at HTI I attended, learned a lot. And now I think it's really going to be really hot topic. And I think it will be difficult to implement this aspect at national level, while really easier to implement this at hospital-based level, sure, because of the awareness of hospital managers.
Of course. Thank you, Iga. I would like to involve also Rabia to, make our view a bit broader. Because we know that this approach, HTA, has been, starting from developed countries, US, Canada, and then Europe, Northern Europe, Southern Europe, Latin America, but little by little is spreading worldwide, which is the state of the art in terms of diffusion of the use of HTA in low and middle income countries. And I asking to Rabia because she had a huge experience, in trying to promote the use of HTA in also difficult territories. The last one was Ukraine. Rabia.
Well, thank you for the question. Yes, we should definitely discuss how HTA is in these difficult settings. Yes, indeed, majority of my experience is in low and middle income countries, and my most experience in Turkey, my own country, and Ukraine the last 5 years, and with the war, definitely HTA becomes even harder to implement. But for Ukraine, starting from the last, it's also interesting that it's one of the countries, which is a rare country, who implemented HTA in a very short time with full implementation despite the war. So I can say that it has huge impact on the healthcare decisions right now in war conditions. For developing countries, our discussions and our challenges are a little bit different. Some of the challenges apply because right now we say capacity is always limited. We need more human capacity to do HTA and so on. So that definitely applies to all countries. But when it comes to developing settings, when we talk about capacity, it's indeed very low. We sometimes talk about like 1 or 2 persons in the country, in the whole country, just 1 or 2 people who can actually engage in doing it, even sometimes with no experience of doing it. So this is the context we are talking about. And with respect to the healthcare system, the systems are not developed well, and there's very limited access to even essential medicines or essential healthcare systems. We can talk about countries where we have no screening program, we don't have vaccination programs, or very basic, like a few vaccines can only be available for the population, or the medicines reimbursement programs can be, or benefits packages can be very limited. So introduction of HTA in these contexts are actually more important, because this is where you have to use even those very limited resources more efficiently, because you don't have money. You have extremely limited resources, and efficiency becomes very important. On the other hand, the healthcare decision-making culture is sometimes the culture does not allow evidence-based or very structured or transparent decision-making. So it makes it indeed very hard to introduce HTA, but I'm happy to see that there are now many countries in Africa. I think Africa is one of the interesting continents that there's increasing interest in introducing HTA. And in Central Asia, we have a lot of countries. Recently, actually, I was engaged in European Observatory policy dialogue in Central Asia, and it was very interesting to see like Kazakhstan, Kyrgyzstan, Tajikistan discussing how they can introduce HTA in their systems. So there's so much going on. I would say the major challenges in those regions are definitely the political will, the culture, decision-making culture, the political will, and sometimes the difficulty of changing this culture towards transparent and evidence-based decision-making, where you have independence of HTA functions. So those are the challenges we are facing, and capacity definitely is one of the major challenges.
Yes, thank you. And actually, probably this is not the problem only of low and middle income countries. The attention of politics in using evidence for decision making in general is not so. I think that is easily diffused worldwide. Okay, thank you very much. I would like to get the chance to see if there are questions from the audience. I would like to thank you all for the valuable contribution. We have some microphones around. Let's see if there are, questions. Here.
Right, so I'm Damian Graves from the Caribbean, the beautiful island of Grenada. I'm not being paid to talk about the beautiful island of Grenada. This is not a paid announcement. But I have a question. In the Caribbean, we have a lot of difficulties. We have some challenges in terms of the introduction of HTA. I want to confess that it is the first time I'm hearing about it, so I will take that back to my region. The point is, our difficulty is what you call the transfer of technology. Not only the human resource constraints and the financial constraints, but just imagine, just a simple thing. You import an MIR machine, but you do not have the requisite human resources to repair it. Neither do you have the importation of the know-how to deal with the repair of it. How would you advise me, as the manager of a health system, to deal with those kinds of issues? Thank you.
Thank you. Very interesting question. Rabia? In the hospital and in the system. I mean,
to also manage the technology.
Yeah.
Well, I think that's
and
more of
HTA
Laura's. And
is able to consider this problem. So the context is something that is providing value. So if I have no context, how should assess that technology and how overcome the problem.
Yeah, I'll just say shortly because I think Laura and Ika has more experience in this, but I think it brings us to the discussion on organizational aspects and so on. So basically, when we look at the technology, it's not only about like in laboratory conditions, how it works and how does it cost, but it's more about in real life, how it will work. And how it will work definitely has different aspects, like social and professional different aspects, and also organizational aspects. You need to have people to actually use the technology and to repair it, or you need a place to put the technology if it's a big one. So definitely there's the organizational aspect, but I will let Iga respond.
Yeah.
Yeah, nice question, however, very tough. So I will take the challenge. I think there are many different aspects. So first of all, people need to be aware of the issue. So that's awareness raising activities, let's say. That it should be like evidence-based approach or evidence-based decision-making process. Then you can like dig into different layers of this decision-making processes. So first, at least from my experience, and Laura probably will comment as well, clinical part, so looking at effectiveness, safety of health technology at hospital level is, let's say, it is in most cases already done by someone else. So you can take this if you've got like contacts with hospitals, other hospitals, or nationally or internationally. So that's done, I would say. Once other aspects like economic aspects, budget impact are really context specific. So it means specific for your hospital, for your healthcare system. And from my experience at least, organizational aspects are of key importance at hospital level. And I'm saying this as a medical doctor because it was something really fresh and new, quite surprising for me. So this organizational aspects. By organizational aspects, I mean the need for training activities, learning curve. You need to consider if you want to buy a kind of nice robotic surgery equipment, which is very fancy, and I wouldn't like to say toys for boys, but some scientists are very keen to buy this. So there are many reasons. There is a lot of competition between hospitals, etc. So they just want to buy this for this particular hospitals. But at this particular hospital, you don't have enough human resources to use this robotic surgery. You don't do enough particular type of operations in your hospital. So it will not be effective from clinical point of view, because for prostate cancer you need a number like 100, as far as I remember, 100 operations per year to be effective. So that is another reason. You need to be like prepared at this organizational level. So just to consider several aspects. So summing up, you can take a lot from others, like clinical aspects, safety aspects, etc., once organizational aspects are really specific for your hospital.
Thank you. I think there was a last comment from Dimitra.
Thank you. Just to build on what Iga and Rabia have already said, and to say, I think the reason why we see health technology assessment as such a useful mechanism for health system strengthening is that if you use it as it is intended, as a multidisciplinary approach, it will show you that you also need, for instance, to invest in training biomedical engineers. So that this is the type of thing where it's not just about, is this technology slightly better and cheaper than the other alternative, but it helps you understand where the weaknesses are in the process as well. So I think this is something to look at in a holistic way.
Americo, if I might just...
Laura, yes. Last.
Last one.
We are close.
Okay, so HTA, first of all, if I would be in your hospital, I would say first, let's look if there is a real need for that. If there is a real need, as somebody mentioned, we have patients for that. HTA is not only saying, okay, this is of value for you. The last step for a hospital is saying, okay, if it's of value for your hospital, this technology, how to implement this technology in your hospital. So we give you like hints and chances on how you have to implement that. What are the requirements you have to implement? And give also some advice on how you can achieve these requirements. So, and sometimes from our hospital, sometimes we also can advise on where to look for the money to get this, if you need the money, right, for example, to hire somebody. So we at hospital level, we don't stop saying, okay, this is for value because it's safe, you have the need, it's safe, it's clinical effective, it's cost effective, your budget impact is okay. We also let you know how you have to implement that in the hospital.
Thank you, Laura. One question, but many answers. Marco, 1 minute, no, less than 1 minute, 30 seconds, because we need to close.
Two words, just to remember that in order to bring HTA into practice, we need to think to HTA as an ecosystem. So it means that each level of decision-making process have to give its own work. So HTA regulation is focused on the effectiveness and safety. Organizational issue as member state responsibility. And also in the context of member state responsibility, national, regional, and hospital level have to give their work.
Thank you very much. A big applause to the panel that was able to maintain the attention. Thank you to all of you. In 5 minutes, the annual general meeting, annual general assembly will start. Aula number 2. And for members, the lunch is served inside. Okay, for the others is there, you know. Okay, thank you very much. Thank you all.